Hey, what's up everyone? Dr. G here. I want to talk about something that's going to affect probably about 1 in 10 Americans at any given point in their lifetime, and that is kidney stones. Super exciting, right? But I had a patient case recently, so I wanted to dive in and just give you some of the high-level things to be thinking of when you're thinking about kind of risk for kidney stones and what you might be able to do about it, or what you should potentially keep your eyes peeled for as it relates to that. So let's take a look. Okay, so a big piece of kidney stone formation is genetics. So we absolutely cannot get around this fact. And I've identified at least 8 different genetic polymorphisms or mutations that regulate or have an established correlation to kidney stones. So interestingly enough, vitamin D, the vitamin D receptor, something that's called a sodium-coupled decarboxylase channel receptor, and another one is the calcium. Let's see, just make sure I get that name right. Calcium sensing receptor, which is this one. But there's more. So not to get too dorked out about it with all of you, but the take-home message from this is that there are quite a number of genes that are regulating things like calcium resorption in the kidney, calcium absorption in the gut, all sorts of interactions with other systems, hormonal or otherwise, to regulate the amount of both calcium and and some of the other most common piece of part of the kidney stone is called oxalate. So it comes as a salt. Calcium oxalate is what it's formed as, but these two things can be interacted in the body separately. They tend to form these kidney stones in the kidney where that resorption and aggregation tends to happen. So that's on the genetic side. So I think you can't really get around that, but what we can do is affect some of the modifiable factors, things like diet, reduced hydration has a direct correlation to kidney stone formation. High oxalate diets, if you are genetically predisposed to being a stone former, you're going to want to take a look at, the oxalates in your food. Calcium and calcium supplementation as well, which I didn't put on here, but I will. And also oral vitamin C. There does seem to be a difference between oral vitamin C and intravenous vitamin C as it relates to this topic, so keep that in mind. High dose, continuous, long-term vitamin C is probably not your best bet if you are predisposed, or you think you may be predisposed to forming kidney stones. Medications, wow, I mean, this is a big one. Large percentage of the population is on medication, so some sort of medication, and some very common ones, things like diuretics, blood pressure medication, calcium channel blockers, proton pump inhibitors for things like acid reflux and GERD, estrogen therapy, and thyroid hormone. Less percentage of the population on something like chemo, but that's worth considering as well. Hormone therapies, yeah, so interestingly enough, testosterone therapy certainly should be monitored for the potential and the risk of stone formation. Stone formation is slightly more common in men than women, however. Estrogen therapy, Estrogen does affect calcium metabolism, but I think the jury's still out on this direct connection. I did find a study that I looked through on that, but just one. So I can't conclusively say, but testosterone, we definitely want to be careful with that. Another really interesting piece that might get overlooked is the health of the gut. So this is really kind of wild, and I was really interested in this as it came up. As we know, the gut is connected to everything. So here's just one more thing that we can start to shine a little bit of perspective on. Healthy gut can help prevent the recirculation or the resorption of these, of both calcium and oxalate during digestion and through the intestines, so that, you know, potentially kind of regulating that process a bit more than we might if our gut microbiome and the bacteria in our gut is not as balanced as we'd like, or if it's not doing its job correctly because of things like inflammation, infection, etc. So there's some very specific bugs. One is called Oxalobacter, a long name, you don't need to remember that. Bifidobacterium and lactobacillus, those are very common in all sorts of fermented foods, whether it be dairy or other. So once again, these things here, we can generally be modifying through lifestyle, prevention, active and proactive health. Genetically, these are the things that we are going to have to work with as it relates to this type of metabolism. So, obviously focus attention on these things down here. If you have any questions on this, shoot me a note. I'm happy to, dive in and expand on the conversation today. So anyway, hope you enjoyed it, and take care. We'll talk next time.